The most life-threatening complication of heparin therapy is type 2 heparin-induced thrombocytopenia. You watch patients after 5 to 10 days after initiating heparin therapy, and you want to see if their platelet count has dropped by over 50%. The thrombocytopenia is actually a very minimal bleeding risk, but for people studying for step 1, remember that it's antibody mediated. The one thing that you really want to look for these patients that suspect HIT is thrombosis risk. The number one thing you should do is discontinue heparin immediately, and then you anticoagulate, obviously, with a non-heparin med. You can use fondaparinux or argamitran. Step 2 doesn't like to make things very obvious for you on the question stem, so look for skin lesions where you see injection of heparin. And I know I said 5 to 10 days you can start seeing suspicious activity, but remember that it can also acutely happen. We diagnose this with a gold standard serotonin release assay, and even if you suspect a case, just start the treatment, even before you do any confirmatory testing. For those studying for step 1, remember argamitran is a direct thrombin inhibitor, and fondaparinux is a synthetic pentasaccharide. Remember I said that bleeding is not a really big problem with HIT, so transfusions is not really the best answer. We don't use warfarin right away, and even if we did, we want to still give the patient a different anticoagulant, and the reason is because protein C levels are lowered when you give someone warfarin. This automatically increases their chance of thrombosis. And to review, activated protein C has a cofactor protein S, and it causes the formation of APC complex, which in the end really just inhibits factor 5 and factor 8. And if you lose coagulation factors, that means you increase your risk for thrombosis, just like I said. And for these patients, avoid all products that have to do with heparin, including low molecular weight heparin. But remember, like I mentioned earlier, fondaparinux can be used, which is synthetic heparin.